Welcome again. Today, I'll be talking about access to mental health care and the causes of limited access. I will also address the effects and strategies or interventions in place. One of the causes of limited access to mental health care has to do with underfunding of mental health services. And this is when mental health often receives less government funding compared to physical health services. Another cause is stigma and cultural biases. And this has to do with societal and cultural stigma around mental illness, which discourages people from seeking help. Also, there's another cause, which is healthcare inequality, and these are differences in access based on geographic, income, race, or social status limits can also affect individuals. And also, we have policy gaps, which is another cause, and this looks at mental health policies, which may lack enforcement or fail to address diverse needs across populations. So, some of the challenges of limited access to mental health includes high cost, and this has to do with therapy, psychiatric services, and medications, which can be expensive, especially without insurance coverage. Another challenge would be shortage of professionals. For example, there aren't enough mental health professionals out there to meet the demand, especially in rural and remote areas. Another challenge or effect is long wait times, because public mental health systems often have lengthy wait times and appointments and treatments. So there is also, in addition to that, the lack of integration with primary care. And this is when mental health is often treated separately from physical health, making coordination and early detection very difficult for individuals. And lastly is language and cultural barriers. So lack of cultural sensitivity, care, and language support can exclude many minority and immigrant groups because of the language and cultural barrier. So some of the interventions that has been addressed includes increased funding and policy reform. What this means is that they will allocate more resources to mental health and enforce parity with physical health coverage. There is also the telehealth expansion, and this uses digital platforms to provide therapy and support, especially in undeserved regions. And also there's public education campaigns, which raises awareness to reduce stigma and promotes mental health as a normal part of overall well-being. And there's also integrated care model, and this include mental health screening and treatments in primary healthcare settings. Another intervention is workplace development, and they look at training and recruiting more mental health professionals, including culturally competent and bilingual providers. So lastly, there is also another intervention, which is the community-based programs that support grassroots organizations and peer-led initiatives to deliver localized, accessible care. So this is how the government and policymakers have designed or come up with these interventions to address limited access to mental health care. I hope this has been helpful and or has shed some light on the topic. Thank you for stopping by. Have yourself a good day, night, or evening. Bye for now.